Good morning. It's 10 o'clock and we are ready to start 10 o'clock in the Swedish time, but whatever it is in your own home clock. We are very glad that you joined us this morning. And the topic is something that is all around us at the moment, the COVID-19 situation, which is burning all over. When the Northern Board met in June, already then we had an online meeting. Of course, we were discussing and planning the November 18th meetings, and we were really hoping that by that time we could have a physical meeting. But the situation where we are at the moment is clearly telling another story. We are experiencing the so-called second wave, and nobody knows exactly where we are heading. And alcohol has played an important role in all of it. We understand that this social problem, which is a daily issue for most of us who are today gathered into this meeting here, the society now also is wondering how much can we and should we regulate alcohol sales and consumption in these times, because as we can see, alcohol causes even more problem. And this is our aim today, to listen from different country representatives. What is the situation when it comes to alcohol and also maybe drugs during the COVID-19 period? It is possible that, as yesterday, Harake had their own webinar on COVID situation, and Professor Jürgen Rehm was giving a presentation. Maybe some of you heard as well, and he said that it is, of course, very difficult to speak about the problem that is ongoing at the moment. We will be much wiser when it's over. But today we just want to give you all glimpses of the situation from different countries. And we will start with Iceland, with Arni Einarsson, who has been our board member for a very long time, and who will give an overview of the situation in Iceland. Arni, please share your screen, and the floor is yours.
Thank you, Lauri. Good morning, and good morning to all of you. Now we have to see if this is all going to function.
Yeah, very good.
Okay. Yes, only some very brief points from about the situation in Iceland. It's a little bit hard to use data or figures from the alcohol monopoly on the sale of alcohol and compare it to last year, because in 2019 we had more than 2 million tourists coming to Iceland, and for a country with only just about 360,000 inhabitants, it makes a huge difference. So although Icelanders have not traveled to other countries at the same time, it makes it very hard to use to see if there has been any difference in the sale of alcohol. So the best estimate we have is our surveys on self-reported alcohol consumption, and I'm going to give you some information or some example of that. I'm using data from a survey that the Directorate of Health conducted in May 2020, and people were asked about their alcohol consumption, or rather asked about changes in alcohol consumption during the first wave, as we call it, in March and April this year. So if I'm just going to go in my short time briefly through this. So 90% of people said they drank much less or less often than usual. It's about the frequency of alcohol consumption or drinking. 10% said they drank a little less often than usual. And 56% said there have been no change in their alcohol consumption or frequency of alcohol consumption during this period. 13% said they drank a little more often than usual, and 2% said they drank much more often than usual. And then to the right we can see that this is majority didn't change their drinking at all, 56%, and 29% said they drank much less often than usual. So this is rather positive in the whole, you can say, I think. Then had there been any changes regarding quantity people were drinking? And then we have the very similar situation. 90% said they drank much fewer alcohol drinks than usual during this period. 11% a little fewer alcohol drinks than usual, and then again 56% said there have been no change in their alcohol consumption. 12% drank a little more, and 2% drank much more substandard alcohol drinks than usual. And still this is a very similar picture overall. 56% said they didn't change their consumption at all, and then 30% said they had been drinking less alcohol drinks during this period than they have been than usual. And then some information about binge drinking, which means that people are drinking 5 drinks or more at a time. And still we have a very similar picture. 29% said they had been drinking much less often, that amount of drinks than usual. 6% a little less often, and then 60% said they didn't change anything, and then 3% a little more often than usual. And and then we have still very similar picture of drinking of alcohol, or binge drinking of alcohol during this period. So the only change we can see from this is that majority of people either didn't change their alcohol consumption, or even drank less than usual during this period. And then if we look at gender difference, then we can see that when we start from left, and we see men are a little bit darker, a little bit darker columns than women, and then we see that there are a little bit more men than drank, say they drank less often than usual than women. There's no big difference. And then little more men are saying they didn't make any change. They drank as much as usual during this time, and then little fewer men said they drank more often than usual. And then I'm not going to go through all these columns, and as you can see, there's no big difference between the sexes regarding this. And then to the far right, you can see that women tend to drink a little bit more often during this time. We have no explanations of this, but there's no huge differences in this. This picture is a little bit more difficult to read, but I'm just going to try to show you what it means very briefly. If you start from the left, and there's different age groups, as you can see below, aged 24 and 18 to 24, and then over 25 to 35, and so on. So we can see that and it's very positive that the youngest age group say they drank less often than usual. So, and as you may know, we have been emphasizing on our young people in our alcohol prevention work and policy work in Iceland. So this is positive that we can see that our young people are responding to this in a responsible way. And then if we go to the middle part of the slide, then we can still see that the young people are saying that they are drinking less drinks than usual, and it goes on. So this is also positive and in line with what we can see from other age groups. And then if we and I'm still using surveys from the Directorate of Health. They had a survey now in 2020 in this fall where people were asked if they were asked to compare their drinking in 2019 and 20. And there are 4 different periods, January and February, both in 2019 and 20, then March and April, May and June, and July and August. And we can see if we compare in January and February, these 2 years, that there are fewer men saying, and this is binge drinking, and which means that they are having had 5 drinks or more at a time, this period. And you can see that there are fewer women that say that they have been drinking this much in no, we start with men, of course, to the left. That there are fewer men drinking that much in January and February 2020 than there were in 2019, and that's the same for all these 2 months periods throughout August. There are fewer men saying that they are drinking 5 drinks or more at a time in all the months of 2020 than in the same months in 2019. And a little bit more controversial data regarding women, but still we can see the tendency, except for women in 2020 drinking a little bit more than in 2019, and we don't have any explanations for that. So this is the best estimate we have on changes in alcohol consumption during COVID-19 time. Then we haven't had many measures to influence or control the alcohol consumption by law regulations or limitations of alcohol sale or alcohol consumption. In the first wave, our medical director of health, she warned of the negative effects of alcohol consumption and encouraged caution and moderation in alcohol consumption. And she even pointed out or recommended that now is a good time to quit smoking and the use of alcohol. And this indeed was a very strong message, which quite many public health, especially public health organizations, or quite many actually non-profit organizations responded to, and they distributed the message and sent it to their members, and also on their Facebook sites and home pages. So this was, and the media did that too, though. So that it was very good message, and our director of health is also highly respected in the country. So this was a very valuable message coming from her. And then the only measure we have taken directly aimed at alcohol is that pubs have been periodically.
Just a small comment, if you could try to briefly now finish it in minute or so.
I have about 20 seconds left.
Okay, very good.
So the only direct message we have made is that pubs have been periodically obliged to close or limit their opening hours since March. So this is the only direct attempt we have had on this in this area. So I'm not going to go through this. This is just we can call non-COVID-19 alcohol-related policy measures. We lowered our blood alcohol allowed blood alcohol concentrations for drivers at the beginning of this year. Alcohol tax will increase now in January 21, but on the other hand, the Minister of Justice has introduced a bill which will, if it will go through, will allow online sale of alcohol, and that is a little bit against other things happening here. And this is just regarding drugs. And as you said, Lauri, my time is over, so I'm not going to. This is probably really available afterwards, so you can look at it if you like. So that's it. Thank you.
Thank you, Arni. Thank you very much. Very detailed data that you have already available. As I mentioned in the chat already as well, these slides, if all the speakers are okay with that, will be disseminated. We will upload them on our website and send it to all the participants directly as well. So thanks a lot, Arni, and we move on to Denmark. Christian Bjerre is from the Blue Cross Denmark and will give us an overview from Danish situation.
Yes, and I have just an oral presentation and not a very good slide presentation, so that's the way it's come from Denmark today. Until now, we have not a very solid figures about alcohol consumption yet, but most experts think that we have a decrease, as we can see, a little similar to the Icelandic situation. there has been some survey indicating that most people has decreased its consume in alcohol, but it's also some groups who has increased due to lack of normal experiences, less social context, and a more boring lifestyle during the COVID-19 crisis. At least we can say that many of the normal drinking arenas have been closed down due to COVID restrictions in this year. That's restaurants, bars, pubs, and especially the festivals where Danes in normal years consume huge quantities of alcohol. And this was not only a restriction in the spring, the first wave, but also now it's limited to 22 hours to have open for the pubs and also the restaurants. So in both phases. Another indicator is that the Danish breweries this autumn told us that 75% of their members has less sales this year than last year, and that many breweries are forced to reduce in their staff. Also, the expectations for Christmas sales is rather low. So we find also it's rather positive that the brewers tell that they have sold a big amount of alcohol-free beer this year. So we have not the clear figures, but we are expecting that the alcohol consumed has been less for most of the people. And we can hope that the corona crisis, many people have learned to have a lifestyle with less alcohol. But of course, yet we don't know. At the other side, the more dark side we can tell about the lockdown and restrictions to meet socially are the consequences for both our vulnerable people and for families. They grew more isolated, and for the children and families with alcohol or substance abuse, the abuse is growing for them. Unfortunately, the care failure and violence has been growing in many of these families, and that's one of the problems we are looking to take care of in the Blue Cross of Denmark. And some few words, the situation on drugs. We know, as a matter of fact, very little about the development in alcohol consumption, but we are knowing even less about the situation about drugs. But also here we are expecting that the traveling restrictions, the borders have been closed in some weeks. Also, the import of cannabis and other drugs are, we expect to have been lower than last year. Of course, it's a little difficult to say whether less import will be compensated by bigger domestic production in greenhouses and laboratories, but still it's our expectations to have a little less of drugs. One good thing about the crisis is all the debates on whether to legalize cannabis and other drugs in Denmark has completely disappeared. So we hope it'll be for some good time. And then about the public opinion on alcohol. Denmark is one of the few countries in Europe where it's possible for young people to buy alcohol if you are between 16 and 18 years. It's especially a problem here that the young Danes in many years have the record in Europe of alcohol consume, both the total but also the binge drinking. But many organizations has been advocating to raise the age limits or to have higher taxes. But until now, the national politicians has been afraid of regulated by law. They said they were afraid of the liberal public opinion and not to lose votes, especially among the first-time voters. But here in the COVID crisis, there have been many changes for different groups of people. And this may be an open window for more bigger changes also in this law field. So we have more than 22 big and small organizations, including our doctors organization, Danish regions and Cancer Society, are in favor of a 18 years limit now. And we hope that this initiative gains momentum and can be realized in the near future, especially when we are over the crisis and the lawmaking machine will get back to a more normal situation that they are right now. Thank you.
Thank you, Christian. Very, very interesting. I think you put it very well and interesting that people are living more boring lifestyles at the moment. This is definitely so. It causes problems for some, and it's healthy for others. If people have any questions, we have the Q&A section as well open and available. So feel free to write, and hopefully our speakers can then respond to you live in that section. So down below you see Q&A and chat room as well. So be active if you want to be. Let's move on to Norway. Stig Erik Sjorheim from Actis, also our board member. Stig Erik, how are things in Norway?
Can you see it now?
Yes, very good.
Because I was thinking when COVID first hit, there were a lot of speculations about what this does to alcohol and drug use. And I think a lot of people were assuming that a crisis would lead to increased drinking or increased consumption. People drink to cope with stress. They had to work from home, and it's easier to drink without getting caught. The day is less structured, so you can start drinking early in the afternoon, or you can drink all evening. So people sort of believe that this would lead to more drinking. But I think for people who study these things, it's a crisis is usually associated with reduced consumption. We saw a lot of things that would, in theory, lead to less drinking. For instance, availability was reduced. People would avoid going to the store. There were longer lines at the state monopoly. Nightlife was partly closed. There were fewer drinking occasions. And in Norway, alcohol became a little bit more expensive because there was no longer any tax-free or cross-border shopping. I think there was a sort of a media bias towards thinking that drinking would increase. And I think the Norwegian experience is pretty similar to what we see in Denmark, in Iceland, and when Jørgen Rem yesterday presented the data from the European study on drinking during COVID, it was the same pattern, that there was actually a small decrease or a decrease in use. But the media would always point to increased drinking. I highlighted this news story that says increased alcohol use during the corona epidemic. And a new study says this and that. And when I looked at the study hadn't even looked at the data. They just had a theory that it would increase drinking. So it's kind of interesting, this idea that drinking is a coping mechanism is sort of the way the media tends to frame things. So we have some data in Norway. Statistics Norway does an annual data collection on consumption pattern. And they found that sales in Norway increased, but there was no change in consumption patterns. I don't think that study was detailed enough to really give a clear picture of what was going on. The study focuses on prevalence, and they found that pretty much the same number of people drank, or the same share of people drank during the corona period as before. But I don't think that you would expect a lot of people to stop drinking entirely because of corona, but perhaps they would reduce their consumption. In addition, a Norwegian polling company called Opinion has established a corona monitor, and where they ask around 50,000 people about life during COVID-19. And one of the questions they've asked is about alcohol use. And we pretty much find the same pattern that Arni described. Some people drink more, but more people drink less, and the majority say they drink the same. The monitor found that the consumption was highest in July, which is not surprising. It was summer vacation, and things were getting back to normal. And they also found that the biggest change in alcohol consumption was in the under 30 group, where 4 in 10 have changed their consumption. And we found the biggest reduction in any group in this among young people. And I think that's probably to do with the fact that a lot of the social occasions where young people would drink are cancelled. For Norway, we've also looked at the purchasing patterns, the alcohol market. And of course, the fact that people can no longer travel so much has meant quite a lot in the Norwegian context. 1 in 3 people say that they would normally have bought more alcohol if they could travel abroad and buy tax-free and cross-border shopping. And the change in Norway was quite dramatic. Cross-border sales went down by 99% in the second quarter. So from April to June. The figures, the purchasing was down from 4.1 billion to 28 million. So it's an incredible change. And this is of course not just alcohol. This is all cross-border shopping. And since cross-border shopping went down, the wine monopoly sales went up by 52% in September, and by 32% for if you count the first 6 months of 2020 compared to 2019. The biggest increases are at the monopoly stores along the Swedish border. So it's clear that it's related to cross-border shopping. But the increase in sales is not any bigger than you would expect due to the changes in traveling patterns and also the closing or partial closing of the bars and restaurants. ACON is the organization that helps employers and workers who face alcohol and drug problems in work life. And they say they have had an increase in calls for drinking or drinking problems during the period of COVID. They don't state the real numbers, but they say that there was a 42% increase in calls from drinkers during this period. So that indicates there is something to this hypothesis about the changes in the home office as a problematic area for problem drinkers. And also some say that they drink to cope with the stress of social isolation. Another group that we're interested in, and there's been some concern about, is vulnerable young people. It's estimated that there are around 200,000 vulnerable young people who live in families with substance abuse problems and mental health problems in Norway. And of course, it's of great interest to see what's happening to these people, these young people, during this period. One of Actis's member organizations is BAR, which is an organization for children and families with substance use problems. And they have an anonymous chat service for young people who need to talk to somebody. And during the COVID lockdown period, they expanded their working hours. And they also saw that there was an increase in calls or chats from young people. What they say, they made a report about this situation. They say that the young people are, it's problematic for them to stay in the home all the time. School has been an escape for a lot of these people. And their home situation makes it difficult to follow the online teaching. They are troubled by boredom and loneliness, and they see more substance use around them. Their parents and older youths use more in the home. There are fewer obstacles to use. there are fewer structures that limit use. So they report more violence, more sexual assaults, and incest. And I think it's interesting because another research institution called Nova did a study on young people, and they found that most young people enjoyed spending more time with their families. They actually had a better mental health during the COVID period. But in this group, this period has been much more stressful. They see the main reason is that they have to be around their intoxicated parents all the time. So one of the children said, it's more of the same but fewer breaks in their daily lives. In Norway, with this COVID period has also sort of started a political discussion. In a sense, COVID has meant the end of unregistered consumption in Norway. So pretty much all the alcohol goes through the official channels. Cross-border shopping has stopped, and that means that all alcohol is purchased with Norwegian taxes. The whole period with the no cross-border shopping has meant that we have increased tax revenues. I think around 5.5 billion Norwegian krona during these months. It means more jobs in Norway. You would expect lower consumption since the price of alcohol increases due to the lack of travel imports. But at the same time, one of the studies showed that consumption is stable. So some people have asked, does that mean that the price, that taxes don't work? And this has also sparked some demands for permanent tax cuts to make sure that alcohol and other heavily taxed goods such as tobacco and sugar are purchased in Norway in the future. Our response is that if you want to secure revenues in the future, you should rather reduce import quotas than lower taxes. So that's pretty much, I don't have any data on drug use. I think it's, as Christian said, we know a little bit about alcohol, but very little about drugs. And some of the things that have happened in the drug markets started before the COVID period. There's been a shortage of cannabis in Norway for quite a while, but that started before Christmas. So it's not entirely due to COVID. Yeah, that's pretty much all I have. Thank you.
Thank you, Stig. Very interesting as well. It's clear, I think, in most of the countries that rather big increases in shop sales they're muddying the situation, and media just jumps on these news. We'll speak a little bit about the situation among women and children. Leena.
Can you make it full screen, please?
Yes.
Thank you. Thank you. Hello, everybody, and thank you for the invitation, and thank you for all these interesting presentations that we have heard so far. I'm the Executive Director of the Women's Organization Committee on Alcohol and Drug Issues, and also a long time Women's Section Chair and Coordinator for NordAN. That's very interesting. And I'm going to talk a few words about women and children and COVID-19 from a different angle than you have heard before today. Please, next one. When we realized and heard and started to see this pandemic, I guess our attitude has been very helpful in dealing with the problems that we see, and also motivating us to do even more than what we have been doing before. We saw early that all the old problems would grow and the new groups at risk would rise due to alcohol and other drugs, violence, shutdowns, unemployment, etc., because our organization, we are an umbrella organization, and 39 of our member organizations work with different parts of these issues. So we have the habit of taking seriously what's happening, and our focus is in women and children. And I have to say that what we have seen, we hope it should never have to happen. Next one, please. The old problems we knew about, it was all the time women being victims of violence, prostitution, children being abused and not cared enough, and so on. And we looked at our activities. What can we do more? What can be more appropriate at this situation? And we applied, and thanks to Socialstyrelsen, the National Board of Health and Social Issues, funded our intensified actions trying to diminish, at least ease a little bit, the consequences of COVID-19. And what we decided to do was to empower our networks to support girls and women. And we have a nationwide and international networks. Bellanet is a network for girl group leaders that we have in every county in Sweden and 17 other countries. So we can reach out to girls in different ages. And MammaNet is a nationwide support network, and it's through MammaNet we have got the worst stories ever told about violence, being hostage, not being able to flee from her home because of violence, and nowhere to go, because society has shut down the most of helping instances, and if not, there will be a waiting time, and you have to call tomorrow 9 o'clock, and it doesn't help if you are dying today. And in this effort to empower our networks, we have conducted 3 webinars to empower at least 100 of the members of Bellanet to reach out to girls, and we are very grateful for our cooperation partner from Iceland, Sigridur Björnsdottir, who is helping us with the webinars to teach out how to prevent and early detect sexual abuse on girls. And MammaNet is our ongoing 24/7 work that is available. And educating key persons has been very important, because this will also guarantee that this is not only for this epidemic times, but the knowledge will follow, and it will be helpful a long time ahead when professionals are meeting young girls. And we have also invested in raising awareness about the situation for children and women, and we had the first showing of our new film called See Me, and it's about young, both girls and boys, how they have had it during COVID until this August. And we are describing the emptiness, the loneliness, neglect of having parents who are not taking care of them, and so on. And it will be, it's a 10-minute, 11 minutes film that we are going to launch widely during the last months this year. And we have also, this is only a few examples, we have arranged girls' camps because many of girls have been locked in, not locked out, locked in their homes and nothing to do, and especially during the summer. Please, next one. The next slide, please. As I told, many of our member organizations are hands-on to help vulnerable women. And this is our latest member called the hashtag utan skyddsnät in Swedish, without any protection network. And they are helping homeless women in addiction, because here the authorities say, stay at home, wash your hands, keep distance, and so on. And if you don't have a home, you can't go home. And you are not welcome to the public toilets to wash your hands, and so on. So one of our member organizations is doing this very elementary work to provide some products for women that they can take care of their hygiene. And this is ongoing every day. Next one, please. I wanted to show a couple of pictures from our girls' camps during June and July and August this year. And it's seldom I get very upset at work, but when I saw the paintings of this is from one girls' camp. We arranged the allowed number of participants with 2 meters distance to each other. They had the arts and paintings, and they were painting COVID trees. And it was really shocking to see that everything that in these young girls' minds were COVID. And they found it very helpful to be able to talk about what's happening in their everyday life. And next one, please. I don't know how often we think that many children and youth are also having a big sorrow. This morning's figures from Sweden are 6,225 deaths in COVID. And many of these girls participating in our camps have lost their grandmother, grandfather, mother, father, and look at the tree that is black and blue. And nobody knew before this camp what had happened to this girl, and then it showed that there are many others too. So there are many issues that children and youth are dealing with that the adults are not supporting them. Next one, please. I'm not presenting statistics because I know that there are many reports they are written, but the real needs of people are not solved here and now with reports. We witness increased isolation, increased alcohol and drug use, increased number of victims of domestic violence, and deaths in near families and relatives. And these are issues that will not pass only by the virus and a pandemic ending. These are experiences, these are issues that people will be dealing long after the virus. And we know that the society is not prepared to take care of all the needs that will occur because of COVID. Next, please. But we believe, and we also want to get the word out that there will be a new day without the virus, one day. And until then, we all will carry out the good work. We can't give up. It's only a virus. Next one, please. Thank you. That's all from me.
Thank you, Leena, for this extraordinary work that you are doing, and keep up the good work.
Thank you.
Thank you. Now we move on to Finland. Juha Mikkonen from EHYT, also our board member, will talk about the situation in Finland. You are muted.
Okay.
Yes. Now.
Yes, now it works. Okay, hello from Finland. I'm happy to have a quick, short talk about alcohol and COVID-19 in Finland. So I work as a director at EHYT, that is Finnish Association for Substance Abuse Prevention. Just some background for this situation. So in Finland, we know quite well that the substance use is strongly connected to social inequality, because if we look at the Finnish men that earn the least, who are at the lowest income quintile, they die approximately 9.9 years earlier than Finnish men who are earning the most. So for women, the difference is 4.9 years. And what we know from research is that alcohol and tobacco use are associated with these differences. And if we just look at the COVID situation, we have to, I think we have to consider the level of alcohol use, how much it is consumed, but also the distribution of harms, and look at the people who are consuming the alcohol and what's their background and what's their socioeconomic situation. Later in this presentation, I'm going to highlight some of our findings and views on this issue, like I mean the distribution. I think the COVID should be looked from the social perspective as well, and look the availability of alcohol, what's happening and what kind of effects it has to different groups. In Finland, as background, of course, we have been applying the WHO best buys, price availability and advertising, and how those are controlled. And and the basis of this thing is that in Finland, traditionally we have thought that it's very difficult to change the drinking culture, and politicians should make decisions that they can do. They can decide to change the drinking culture, but they can have an influence on the availability of alcohol, for instance. So what has happened there? It seems that many problems have culminated during the coronavirus pandemic, and we have found that especially in those families where alcohol has been used, like the level of alcohol use has been high, they have been consuming a lot of alcohol. This isolation challenges their situation and can make it worse. For instance, if there's layoffs and they spend more time at home, and if there's issues in the family, for instance, violence or other problems, those might increase. And we should, I think, in this situation, we should look not only the consumption at the individual level as a personal issue, but consider the harms to others. Just a background, what's the level? A quick background: the total consumption of alcohol in Finland is around 10 liters at the moment. It has been declining. There have been 7 alcohol tax increases during the past 10 years. There was a new alcohol act. It would need some more research, because after the act came in force, it happened that the total consumption a little bit decreased, but alcohol-related deaths increased by 125 cases after the new alcohol act. It meant that the stronger alcohol was sold in grocery stores. That was one of the main things that the new act changes, and also that alcohol pops were sold in grocery stores. So this is just the background. It's what's the alcohol consumption by distribution channels in Finland. So what we know, we have an alcohol monopoly, state-owned alcohol monopoly, Alko, and this is the Alko's share, and then we have like the whole retail consumption of alcohol is around 71%, and consumption of alcohol in restaurants and other licensed premises is 11%, and unrecorded consumption, so cross-border trade is 18%. But what happened in the spring when the coronavirus epidemic started? In March, the government asked people to avoid all non-necessary travel, and many people stayed at home to work remotely, and schools began distance teaching, and the borders around Finland were closed almost completely in mid-March, and it of course meant that cross-border trade, imports from other countries basically stopped. But in the beginning of April, also restaurants were closed. They were allowed to sell takeout food and mild alcohol drinks. But in May, schools returned to distance teaching, returned actually from distance teaching for 2 weeks. So they were open for 2 weeks before the summer. In the beginning of June, restaurants were opened, and Estonia allowed people to come to Finland more freely again. And retail sales of alcohol, after that, retail sales of alcohol grew in March and October, of course, because restaurants were closed, so the sale in restaurants was decreased. But we don't have statistics, like official statistics, what has happened to the alcohol consumption yet. So that we'll be seeing later. It's very likely that the alcohol consumption in Finland will decrease in this year, 2020, because the capacity of restaurants has been limited. Large events such as summer festivals and other events were not organized. And of course, we have reduced our social contacts. People spend less time together. And we have remote work recommendations still in effect. And probably this will take a long time before we get back to normal. But this, I think it's very important to consider the inequality perspective in this, because this kind of changes have different effects for different socioeconomic groups. And if we think that in public places, police has to intervene less, but there's an increase of house calls for police, of course, because people spend more time at home, but also it's that many things can escalate at the home, and very often alcohol has some role in that. And also we know that from Finland that the number of drink driving incidents has grown. So the consumption of alcohol has moved from restaurants to homes, and of course children are present, and this situation has caused stress for people in working life. You have to combine remote work and childcare, and then there's the blurring line between working hours and free time, and then people have stress because of temporary and permanent layoffs. And I think the case is that especially with those people and in those families that have had problems before, they will have more problems in this case, many of those, it seems. And then the long-term challenge is unemployment and alcohol use. What we know from when we had in Finland economic regression in 1990s, so alcohol has had a big role in the long-term unemployment and the health effects that it has. But we know from our services, we have a 24/7 helpline where people can call if they are worried about their own substance use or the substance abuse of their close ones. So in the last spring, the calls that we received increased by 19% compared to the previous year, and most of the calls we received were related to alcohol, like 61%, and 90% were related to drugs, and 12% actually to pharmaceutical drugs. And especially people who called me, called the EHUT helpline, they had the situation that they have been laid off, and they might experience that the drinking has become more of a daily habit, and they didn't have these structures to control the drink, so they didn't need to go to work in the morning and so on. So it has challenged them. But we also received calls from people, their relatives and close ones, who were worried of the situation. And of course, we received more calls from people who live alone and felt even more isolated in this situation. But the political situation in Finland, unfortunately, this has been a little bit a paradox, because we have had increase in political discussion for allowing home delivery of alcohol and restaurant takeout sales of wines. And what it would mean if restaurants would be allowed to deliver alcohol to people's home, it would challenge the basis of the whole Finnish alcohol policy. And the government program has a sentence that this is for the safeguarding the alcohol monopoly. But for especially small breweries and restaurants are calling that we should open the alcohol market, because we have to think of the economics and what's the challenging situation of restaurants. So they argue that alcohol would be the thing that saves restaurants and small breweries. But the challenge with the whole situation is that it's almost impossible probably to limit this kind of policy decision to only to small breweries and to restaurants. I think it would mean that the whole alcohol monopoly would be challenged, and this would basically lead to dismantling the retail sale alcohol monopoly if allowed. But this is in Finland. This is marketed as a case for small restaurants and small breweries. But I think the political parties who are for this, they basically use this as a tool to make the situation with the monopoly more challenging. Because it's also an economic thing, because the Finnish alcohol market is total of 5 billion euros per year. Alkos, the monopoly's turnover is more than 1 billion euros. So it's a quite big thing in terms of money. And EHUT doesn't support or oppose the monopoly of retail sales as such, but it's a matter of public health. Because if we think the availability and outlets, if you have 360 Alko stores, and if you would open the market, we would have like 5,000 grocery stores and kiosks selling alcohol. So it's a huge thing. But to finish, our organization as an NGO doing substance abuse prevention, we want to ensure the continuity of substance abuse prevention in local communities, like work communities, our day centers, and use our models what we have been doing. And it's especially important to support vulnerable groups during the crisis, and see and support that they get past this and limit the damage as much as possible. But also in Finland, we have also another challenge with the whole funding model of NGOs at the moment. So because there's also calls for dismantling the gambling monopoly, and but it's state owned, and now the money is channeled to NGOs, and if you would have a license-based system in gambling, the money that could be distributed to NGOs would be much less, but this is very complicated issue, but that's something that is also discussed at the moment. Anyway, I will stop here, and thank you all.
Thank you, Juha. Very good overview of the situation. But as you mentioned as well, many countries will still wait for the raw data that we need, of course, regarding the consumption. Now we move to Lithuania. Nijole, Gostautaite, Midttun will give an overview what is going on in Lithuania.
Hi everybody, and I will try to share the screen. I'm not sure if you can see it now.
Yes, and make it full screen as well.
Starting from the wrong end. So it's very good to see all of you, and I'll try to be brief on the reporting on alcohol and COVID in Lithuania. I represent Lithuanian Tobacco and Alcohol Control Coalition, and it would be enough to show just this one slide, and it will be kind of clear. So in Lithuania, during the quarantine time, alcohol consumption has reduced, and reporting by different data basically shows about 10% reduction in the first 7 months of 2020 compared with 2019. And there are different reductions for different alcoholic drinks groups, ranging from kind of 1/4 to 4%. But overall alcohol consumption has been reduced according to the tax inspection data, which provides information about the sales. At the same time, there is a reduced alcohol-related health harm, and that we know also from the mortality data from hospitalizations. And one of the most clear indicators is the 50% reduction in alcohol poisonings requiring hospitalization in March-May 2020. So it's a 50% reduction, which is quite substantial. It has been reduced from approximately 1,250 to approximately 620. So it's a really significant reduction. Also, as estimated by numbers, this is not a standardized indicator, but in March-July, there is a 20% reduction in suicide. So both of these numbers are quite closely related to alcohol use and are consistent then with a reduced alcohol consumption. So overall, you can say that alcohol consumption in Lithuania has been reduced based on kind of hard data. However, when you read the media reports and when you read the headlines, it's very difficult to believe that, because these are just a couple of examples of media reporting about the alcohol in Lithuania. And it says that maybe alcohol consumption has been reduced, but maybe have not been reduced. Maybe it is the immigrants that are still taking alcohol in private vans, and all kinds of really creative explanations. Also saying that publishing only in popular media, publishing information and data about the scientific research, which claims that restrictions have not reduced alcohol consumption in Lithuania, when we have seen a dramatic decrease in consumption numbers from 2016 until 2019. So So the media reporting on the hard facts and the real facts and reduction in both consumption and harm is very dubious, and you really want to check the reality from time to time, because the public discourse in media is very, very different from the actual reports. However, there is a context for that, and we should have expected a reduction. We have expected reduction from actually early March, because access to alcohol has been severely restricted. Bars and restaurants have been closed, clubs have been closed. Earlier restrictions on alcohol availability, reduced hours of sales has been introduced for a while already now, so it also has an effect from earlier. And there was during the first quarantine, there was no cross-border shopping, meaning no Poland, no Latvia, etc. So at the same time, we know that there was an influx, at least in the tens of thousands of people who have returned to Lithuania to stay over, those who have migrated, for example, for employment reasons into Europe, etc. I have to say that alcohol reduction is consistent with earlier reductions in consumption during the crisis times in Lithuania. It was very similar during the economic crisis in 2008, and then we have seen these reductions in other crises as well. Police reports also show reduced access to drugs and also illegal alcohol. That is according to the police reporting. We have seen a somewhat worrying increase in opioid poisonings, but these numbers are, as usual, they're very, very low. So it is a little bit difficult to assess how significant that is. There are mixed reports about violence in close environment, in homes, especially violence against women and children. There are some reports about the increase, a kind of stable and not lower death toll, for example, for murders and similar, and some of the significant injuries, but there are lower numbers from, let's say, work-related accidents and similar. Part of the context is the reduced access to addiction services, also alcohol addiction services, because no new patients have been admitted during the quarantine times, which was later liberalized, and it was easier to get tested and also still receive services. Acute services were never stopped, so they were always available, but there is an expansion of accessible services online, both counseling and consulting and prescription drugs and similar. So that kind of helps to mitigate even the reduced access to addiction services. There are also reports that there is an increase in people who are being referred and also receiving some services. There are anecdotal reports about homeless being more disciplined and drinking less. This is the media reporting, and interviews with the director of the homeless shelter says that people are worried that they have been more disciplined and drink less and take care of their health more during these quarantine times and during the restriction times. There are many current issues in Lithuania that are being discussed right now. Effects of COVID-19 towards mental health in all different age groups, and not only in those who have survived COVID, but also in general population. There is a lot of discussion about crisis. However, it has not materialized yet. There are discussions about harm to children and young people, mostly due to difficult circumstances at home, and we also think that this is an equity issue for especially in those families which have addiction problem. Children really have very limited possibilities for for actually fully participating in school and other activities. There is more push towards liberalizing legislation on hemp and cannabis. Renewed efforts, even though there have been a clear rebuttal from the European Commission, but it is an issue in the area of drugs, and also prescription drug use, access to addiction services, and we are enjoying now the debates of the new parliament, which has just been sworn in and will start working. There is a new majority which views alcohol restrictions very differently from the previous parliament and previous government, and we will have an incoming government quite soon. However, we still do not know who the new healthcare minister is. This will also have an impact on both preserving the current alcohol restrictions and control policy, but also paving the way forward for also control issues for drugs and etc. And I would like to finish with kind of good news that probably all this reduced alcohol spending and also tobacco spending, it has also decreased. It seems to the bankers, at least, they have reported today that Lithuanians are getting richer during the pandemic because there are record sums in the savings accounts, and everybody seems to be bracing for tougher times, but they are well prepared. So this is what I wanted to say for now, and I would gladly answer questions if they will come. Thank you.
Thank you, Nijole. Thank you very much. Yeah, the situation and the change of government in your case at this difficult time is of course causing some concern. So we will monitor together with you. Thank you all. Our time is up now. I will skip my own short overview on the situation in Estonia, but I will add that presentation to the list of presentations that will be published later together with everyone else. And this webinar, of course, was recorded, so it can be reviewed fully afterwards as well. Tomorrow probably it will be up.